Any other thoughts on this? I know otherwise there was going to be another question Sam was going to move on to. Any other thoughts? This was really, I think, productive discussion on this. Any
Yeah.
other thoughts before we move
Yeah,
on?
the guidance already 5 years, and we already developed some procedures. We following. We have some observations for FDA. We have now the systems, and they seem we have to move now in different direction. We have to change the system. It seems or not.
I'm so sorry. I'm not sure I caught all of that. I don't think that we're signaling something that requires the change of a previously recommended system, if that was a concern. So if you had a good quality management system in place, I don't mean to signal here that somehow the whole thing is being reimagined. If you did not have a good quality management system in place, I think we're recommending that it's very useful to have one in place.
We already audit several times by equivalency, so we followed bioanalytical method validation, which is requested before. And we have systems, we have SOPs now. 5 years is quite long to establish the system. And now we have to change it, or we have to follow the same system.
Sam, I think for IVPT, IVRT studies, it's kind of challenging because the science is still evolving and the methods are as well. You're more knowledgeable in this area than I am. So that's why it kind of presents a challenge to come up with, this is, once you do this, everything will be fine. But we can put something out based on our best current knowledge and current experience, and also the experience of people in industry.
I would agree. I think the science, continues to evolve. I also think that several labs have invested a great deal over the last several years to building very relevant quality management systems. And so on that part, I'm very hopeful that this is not, something that's just aspirational. In place today are excellent quality management systems that do a very good job of covering those elements that are relevant to IVRT and IVPT studies. The disparity is that some labs have figured this out and have it in place, and it's perfect. It's completely adequate, and other labs don't. So I don't think that the challenge is figuring out what's needed. I think the challenge is defining that so that is well defined for everybody. Would those of you who are here agree with that assessment?
Can I add something on that, Sam?
Yes.
So we are very close to 5 years mark of the moment we published the PhD of acyclovir cream. And what we learned, we as an agency received a numerous submission. And I think, if I refer to what Dr. Basha mentioned on day one, I think this is the time, I think we just want to make sure that the submission is coming nice way, and, it's coming from the very reliable CROs. So I personally feel like this is the time, if we have to take, because down the road, if you go next few more years, and then, that would be used as an excuse that, we've been using this one for a decade, and now we feel comfortable about using the same method that we were following without any, I'm sorry, this is based on, what we have seen so far in the submission. So we don't want to continue that one. And, I think we are seeing a great change in the topical doses form. How many submission we have received with the clinical endpoint, and the moment we introduce the in vitro characterization based approach, we are having a great success, and we want to continue moving forward this one. So I feel like this is the time. And if you look at what I heard from the candle, there was a lot of effort, and I think I personally like I like the way that the approach was taken. And I think this is the time everybody, again, it's not like, I don't want to push everyone, but, I think this is, I feel like going in a right direction to conduct the IVRT and IVPT study. And that way we can, everybody's on the same page. That's just my opinion.